It's time to Ask the Doctors. We have you covered today, from your emails to social media messages to questions from right here in our audience. In fact, we have one from Lauren. Lauren, what's your question?
Hi, I got my implants done in 1983, and I'm having problems with one of them, and it's some pain, and I just want to know what I should do at this point.
Let's imagine we're in my office in Beverly Hills, okay? Just ignore everybody that's around it. So the first thing is getting the history. So I need to ask you a few questions. I know it's back in 1983, so it's been years. And what other changes are you seeing in your breasts with the implants? Do you have any pain?
Yeah, I'm very uncomfortable at this point.
Both sides?
Both sides, but mostly the left. And it's not a thing that I really want, you know, to live with.
Well, pain is definitely an issue. What's causing that? Well, it could be a ruptured implant. It could be capsular contracture. So the next question, are your breasts firm?
Yes,
Have you had a change in shape? Like, are the two sides different?
Yeah.
Are they more asymmetrical? Well, you've just hit 3 out of 3 reasons why you're probably going to be a good candidate to remove this. So I reviewed your scans, and you know, I'm very suspicious of a rupture, of a problem on that left side. It looks so different. You do have a crease in that. There's a fold. I think there may be a failure of some sort with the outer shell, the envelope with the breast. So I brought in my colleague, another big gun from Beverly Hills, board certified plastic surgeon, Dr. Leif Rogers. So I'm gonna go to you, Leif. What side effects have you seen with long-term breast implants? And I want you to start off to come up with treatment options, and that's what it's all about, options, when we deal with our patients.
In terms of the complications with long-term implants, especially the older implants, the shells were a little bit softer. It was a liquid gel versus a cohesive gel. So the new gels tend not to leak and shift and move in the body. The old ones were literally liquid. So if the implant ruptured, and especially if the capsule tore, and even if it didn't, sometimes the silicone can travel a short distance in the body. It won't end up in your ankle.
And if I can interject, Leif, in looking at those x-rays, it does not look like the silicone in Lauren's case has traveled beyond that capsule. It very well may be ruptured, but at least it's contained within that shell.
Yes, that's most likely the case.
So, Lauren, I'm going to go back to you, and I'm going to sort of tee it up for Dr. Rogers. We're going to ask you, you know, what are your biggest concerns? What are your goals? Do you want to stay the same size? Do you feel that you probably need a lift as well? And in your mind, do you think you want to get your implants back, or do you think you just want to eliminate breast implants from the equation in your case?
I would like to just not have any implants. And definitely, you know, I would like to have them reconstructed, lifted, you know, to look normal again. I don't just want them, you know.